Hello, my name's Dr. James Anthony. I'm a boarded veterinary dentist and both boarded in North America as well as Europe. And today what I'd like to do is introduce the GerMed Scaling Kit for cats. These are some unique features where they're much smaller than the standard instruments that you would get from any type of human distributor. The first thing that's in this kit is a dental mirror. And these instruments are all held with a pencil grip. And the dental mirror is used to basically visualize areas in the mouth, such as in the palate here, so make the palatal area of the dentition easier to observe, as well as the lingual aspect of the teeth. This is also very nice for using as a little bit of a retractor to hold back the lips as well. The next instrument is a periodontal probe and explorer. This is a Williams probe. So the probe here has little graduations in it. And these are basically millimeters of graduation. The first line would be is 1 millimeter, then 2, then 3, 5, 7, 8, 9 millimeters. And this is to go into the gingival sulcus and measure into the sulcus to see how deep the probe goes. We know that anything greater than 1 millimeter in a cat is considered abnormal and as a result should be recorded. The other end is basically a hook. It's called a shepherd's hook in this case, and what this is used for is to identify any lesions such as chips, any pulpal exposure, resorptive lesions on the tooth used above the gum line. The tip is very sharp, and if you use it beneath the gum line, you can cause some iatrogenic trauma. So I would encourage you not to use it subgingially. Next, for mechanical scaling in the cat, we have a delicate Morris scaler, and these are used for above the gum line only. This delicate is great for cleaning the fissures of the teeth, of the canine teeth, also the fissures of the molars and the fourth premolar as well, like this, the canine, and also is good for scaling the incisors and the canine. The next is a Morris Zero, which is slightly curved and as a result is very easily used for scaling the premolars and molars on the cat. Next, we will go beneath the gum line to scale beneath the gingival sulcus. So that's the area where we call or refer to as root plating. Now, with root plating, excuse me, there's a number of instruments that we use, and they're adapted to different angles. This is what's really unique with GerMed's instruments, is that the width of the tip is very narrow. So it's very easy to get into the gingival sulcus without causing iatrogenic trauma to the sulcus. So what we would do is we'd put this into the sulcus, rotate around, and then do our root plating. This way it's not wide enough, it's just opposing to the dentition, not to cause any iatrogenic trauma. Now, there are different sizes of curettes. This one is a Gracie 1-2, and these are used to do root plating on the incisors and canine teeth. So the incisors and canine. The next is a Gracie 5-6, and that's for doing root plating on the premolars. And then the last is a Gracie 13-14, which is for the fourth premolar and the first molar. And they're angled in a way to facilitate easier removal of debris beneath the gum line, and also with the width being narrow, it allows easier manipulation and a far more effective job.